So burnout is a word we hear about a lot. It refers to something very specific. In 2019, I was so excited when the World Health Organization added burnout syndrome to the International Classification of Diseases. Now, it's not actually a disease, nor is it a formal mental illness. However, it is an occupational phenomenon. So by definition, burnout is caused by chronic work-related stress. So foundationally, fundamentally, that means that if you're burning out, which many people are experiencing, it is not your fault. And when we look at addressing and reversing and preventing burnout, we look at it at various levels. One of the key places to look is organizationally, looking at the factors that we know, which I'll discuss in a moment, that drive burnout at an organizational and team level. Also, though, we look at an individual as well in terms of how you interact with your work and your workplace, and then also how you take care of yourself. All of these things are really important. Now, for burnout to actually be present, there have to be three very specific components. And I want to emphasize that this is just for information and awareness purposes. This is not so you can diagnose yourself or other people with burnout. You have to leave that to qualified professionals. And if you see yourself in this, or you've really been struggling, or you're feeling particularly exhausted, the place to start is to see your doctor. And I want to emphasize as well, I know there was a question that we had already received about how do you identify the early signs of burnout? As I mentioned, there are these three specific components which I'll discuss, but burnout is a spectrum. So maybe you're experiencing one symptom. That wouldn't truly be burnout because it's just one thing, but it's a spectrum that moves along from sort of light level to more moderate to severe. And it's something that we want to be aware of and keep an eye out for. So the first component is emotional exhaustion. I had that in spades in my residency. It's that feeling that you just have no idea where you're going to get the energy to get through your workday. There's a significant overlap with burnout and depression, especially on the severe end of the spectrum. And there are other things that can make you really exhausted, like having an underfunctioning thyroid gland. So again, if you're really tired, talk to your doctor first. The second hallmark is cynicism and depersonalization. So this is a real personality change that other people may comment on before you notice it. Maybe you used to be really positive about your work, but you find yourself feeling more negative, more resentful. You hear yourself complaining about your work more. Also, the depersonalization piece is the kind of withdrawing from others. If you work with clients, for example, you might find that you're feeling irritated by your clients, or that they've now turned from human beings into obstacles that you have to get through your day. These are all flags to watch out for. Also, reduced efficacy or accomplishment is a sign of burnout. I've been saying to everyone for the last year and a half that we cannot have the same standards for ourselves and others that we had pre-pandemic. There has been so much going on. It has affected everybody's performance, and that's normal. We have to be very patient and compassionate with ourselves and each other. However, if your ability to do your job or be productive has really decreased, or you've lost your sense of accomplishment, like maybe before you thought you were a great fit for your job, you were proud of the work you did, and lately you've really been questioning it, and maybe questioning whether you should even be in your job, that's very typical of burnout. And a lot of people come to me for executive coaching because of my story and because they're feeling terribly burned out, and they often want help quitting their jobs or transitioning to another career. But what I usually find is that once we address a number of the things that I'm going to talk about in a moment, people quite quickly start feeling better, and work starts feeling better. They start feeling better. Their whole life feels better. That the majority of people that I work with actually don't end up quitting. So be careful about listening when it's your burnout that's speaking.